how we end up with, you know, priorities that are so conflicted, because as a sovereign state, we are trying to lead in the development of science and technology because we think knowledge-based economies are the way to go. So all countries are trying to do that. We're all trying to protect our agricultural sectors, and we, well, particularly America in terms of its subsidies and distortion of the market in food, the global market in food, and the European Union as well. And of course, food is something that is important to health and what that does in terms of chronic disease. I don't know how many of you would have read The Age, but I imagine this article would have gone further than The Age. Just the other day, an article said 90% of the Tongan community is overweight and 60% are obese. And why is that? It's because their market in food is so utterly distorted for a range of historical but also contemporary reasons that have to do with the maintenance of the productivity in terms of our own countries and developing horrible canned turkey and sending off our mutton flaps that we don't eat, but of course it's good for our Pacific neighbours. So there's science and technology where our aims are distorted. There is trade where our aims are distorted. There are the ways in which we distribute our foreign aid that have a lot more to do with providing money to our own consultants to go off and do whatever it is that we do in other countries. There's the carving up of developing countries by the various aid organisations that really don't work in those countries' interests, and I don't know whose interests they do work in. So in terms of thinking about global health, there's a lot that we need to do with respect to restructuring our own national economies that's also going to make a contribution